Well, greetings and welcome to Healthcare Leadership Live. We're coming back at you yet again with some content to help you be a better leader in healthcare. And today's guest is Ryan Schumacher from Satisfied Patient. Ryan, thanks for joining.
Mike, thanks for having me. How are you, sir?
I'm feeling awesome, man. I got one of my favorite hats on today and super excited to be chatting with you.
Mike, you know what I didn't know? I didn't realize you went to the University of Illinois.
I did. Do you have
Yeah,
a connection?
I grew up 40 minutes like west of there,
Okay.
and still to this day, I am a Fighting Illini fan, believe it or
Oh
not.
my goodness. Wow,
Yeah.
there's not many of you guys out there.
Yeah, not something I admit, don't tell anybody, okay?
You know
That's
what? It's a great school with better
phenomenal.
better athletics lately anyway.
Yeah, phenomenal school.
But yeah, we're here to chat about patient experience, and this is something that you know a lot about, and something that's really important to clinics. So I guess I thought I would start by, how did you get into working in this area? Like, why did this light up for you?
Sure. Yeah. So, I had a big corporate job. I was working at a tech company, had been there a long time, was climbing the corporate ladder. And unfortunately, my mother got sick. Again, back to Illinois. She lived in that small town west of Champaign. And I had the fortune at that time to be able to, take care of her when she got sick. And what I was doing was, I'm in, rural Illinois, constantly Googling, top rated doctors, top rated practices to take her to try and get the best help possible. And we didn't have a great experience. And it was so, paramount to me coming from this tech job where we're measuring how many breaths of air you're taking in a retail store, why this was lacking in the healthcare space. And so, unfortunately, ended up losing my mother, but found a higher calling, and have created Satisfied Patient to allow practices and doctors to become top rated. So if you're ever in that situation with a loved one, you can find the best practices, the best providers. But ultimately, too, improving the experience. So getting that feedback internally, making changes to the practice, and that's how it all started. And fast forward, here we are now, and it's exciting to see the change that's happening.
Yeah. Well, I love that mission. I'm big on mission, and it sounds like you're kind of driven to create this because you saw a way to serve the patient and the person seeking care, and also the clinic itself, right? I
Yeah.
would think they benefit a ton from that.
Yeah, absolutely. I mean, I think one of the biggest pieces is the internal feedback that you get, right? And as a business owner, you have to know when you're running a practice, CEO, COO, practice administrator, regardless of role, right? What lever needs to be pulled inside the practice to make the biggest impact for the patient experience? Because, as it's very expensive to acquire new patients, and it's much more cost effective to keep the ones that you have. And so learning, what's impacting those patients to maybe not come back to a practice is ultimately extremely valuable.
Hmm. This might be a good time just cover what does satisfied patient do exactly,
Yeah.
so that listeners can understand what it is and how it works. So that kind of help frame our conversation a little bit.
Yeah, of course. So, Satisfied Patient helps a practice become top rated online. So more patients can find them. Also helps doctors become top rated online. And then it gets some internal actionable feedback to deliver the best patient experience possible. So, in simplistic terms, it's a best in class survey process, with built in analytics, AI, to help you run a better business. It's your scorecard, it's your dashboard. it's what you've always wanted, in terms of how to monitor the business. It's a barometer of running an entire practice from start to finish. And I think that's what a lot of people don't understand.
Mm.
And I just, a lot of people have some type of survey going out the door, and they're getting a review or two, or they're getting hundreds of reviews, but they're not looking at the actionable feedback or not making changes, to your point, and what you focus on: influence culture, influence change, influence behavior inside the practice, taking actionable feedback, putting it in a performance improvement plan, right? I had the fortunate opportunity of sitting in on, your class,
Mm.
at the AAO, right? Designing effective pay structures, I believe is the name of
Mhm,
it. And,
mhm.
by the way, excellent class and presentation. And if those who are listening haven't participated in that with Mike, please do. It was phenomenal. I learned tons of stuff. But one of the things in there that I thought was so fascinating that you were sharing was, the performance reviews tied back to, compensation, right? And if you've got a front desk staff, or you've got scheduling staff that you're not getting feedback on, it's not Mike, it's not Ryan, it's not,
Mm.
the COO saying it. Guess what? Now I have all these patient comments that I can use to help, create this performance improvement plan and help with comp, right?
Yeah, absolutely. What I would say is the best clinical practices maximize all the touch points that they can for feedback for staff, like good and bad, right?
Yeah,
A lot of the comments that maybe are coming through Satisfied Patient or Google or Yelp or whatever might be negative, but a lot of them are positive too. And
right.
so if you can take those positive ones and amplify that message, that's a great thing. And so any tool that you can find that gives you more feedback from patients is really awesome, because now that's exactly as you said, that's objective feedback. This is from real patients. I didn't make this up.
Right.
These are patients saying you're awesome, or hey, you really need to kind of speed up or be nicer or whatever, right?
Absolutely. And there's a lot of stuff. Listen, I mean, most of the customers that you and I are working with are super busy practices, right? And that's fantastic. And again, sometimes there's, the day to day, and you forget after the 30-second patient for the day, like I forgot to explain to them why I'm doing the particular things I'm doing in the exam. And it's not because I didn't want to do it. It's just I forgot, and I should have mentioned it, and I should have explained why we are dilating the eye so we can see the whole health of the eye, or whatever it may be. So, those friendly reminders, to the staff, really help with the performance piece.
Well, but we're going out live here to LinkedIn, and I wanted to just throw it out for anyone listening. If you have a comment or a question for Ryan, don't hesitate. You can comment on the LinkedIn post, and we'll see your comments and questions, and we'll address them right here live. But now is probably a good time to get into maybe some of those tips that a practice can utilize to improve their patient experience. But let's maybe start with, like, what are some pitfalls that you think clinics run into or that they create that cause bad patient experience?
Yeah. I think the biggest thing is suppression of the feedback. And so we see it. I know that sounds strange. You're probably like, what is he talking about? Suppression of the feedback. And what I mean by that is not getting the feedback.
Mm.
Right. And so I think we've been doing this for a long time, and we become experts in the space. We've got, a ton of data. But every practice is unique, and, they have their own group of people working at each practice, right? And knowing what those key opportunities are inside that practice may not be the same from, two competitors, in fact, working right across the, street from each other, right? They, even let's just use an ophthalmic example, right? So two competitors who have, similar processes, similar workflows, but at the end of the day, you've got two entirely different sets of people, right? Like a sports team, or two sports teams competing against each other. And we see a lot of suppression of the data itself. And so I think that's the biggest thing. And there's, manual efforts are often, don't retrieve as good as results as, automation does. Right. So, I think, one of the pitfalls, I'd say number one is, make sure that every single one of your patients coming through the door has the ability to give you
Mhm.
feedback. And that's not the case. We're, constantly working with customers who've, used other platforms and other, services in the marketplace. And, there's 7-question surveys and there's micro surveys and there's all these different ways to do it. But the reality in some of those situations, Mike, is they're actually suppressing the feedback. And so they're not getting the actionable feedback directly to the practice. And I think that's one of the biggest pitfalls because, we did an insights review yesterday with a customer and, they were like, hey, this is really hard for us to hear.
Mhm.
We've never had this before. We were coming from, something in the marketplace that just got us a bunch of 5-star reviews. We're 4.9 rated. We've got over
Mhm.
1,000 reviews online.
Mhm.
We've never seen anything like this, because they were suppressing the feedback the way the system worked previously. And so that was the biggest pitfall. And it was a very real conversation that we had together collectively, right? Acting as a second set of eyes and ears with them. And they were learning things that had been suppressed previously. And I think that's the number one thing is, don't suppress the feedback. Make sure you're surveying your patients the right way, which is super important because that feedback is a gift.
Mhm.
And, that's truly where the gold is buried. That is where the growth comes from. And we're firm believers in, making sure that you're getting, feedback from all of your patients, regardless of if they're happy or they're upset.
This show is sponsored by Seasoned Advice HR Services, where I help clinical healthcare businesses to make more money and save more money by hiring better, retaining better, and reducing your HR risk. If you would like an HR assessment or ongoing HR support, please reach out to me at seasoned-advice.com.
Yeah, that's really true in people leadership as well, right? You've got to share constructive feedback, and if all we ever did was give positive feedback, we probably wouldn't have, the best practice that we could possibly have. And so
Yeah.
I'm curious, when practices have heard that tough feedback, I'm sure that's
Well,
probably not the first time you've had that kind of, comment.
yeah.
What's the best reaction that they can have to that?
I think to embrace it. I think one of the biggest things is, another tip for the listeners out there today, I would say is, go through your own process.
Mm.
And we get caught up with that, right? And we're humans, and we roll out software and we test it, and constantly listening to our users. But at the end of the day, like, you have to go through it, and it's like, if calls are falling into, if there's a lot of feedback about patients not getting callbacks, right? Pick up the phone and call your practice and leave a voicemail and
Mm.
see how long it takes. First of all, see what that voicemail says. I think that's probably one of the biggest things, right? Is just, when was the last time you audited, which is not something we even do, but,
Mm.
we get a ton of patient feedback on it. We help you diagnose. We're not treating it, but, when was the last time you called your own practice, right? What is that phone tree experience? What is the messaging on there, right? I mean, I've recently heard some, still with the COVID-19 message on there. Is that necessary? You know what I mean? So, and then leave the voicemail and see how long it takes them to get back to you, or to them to come to you to say, hey, like, did you mean to leave a voicemail? So, feedback is hard, right? It's, we're all human. There's a way to do it, and we give practices a framework to do that, with staffing. But,
Mhm.
one of the biggest things is just go through your process, whatever it may be, so you can get your own feedback and you can go through that as as a potential patient, right?
Yeah, I'm sure that's eye-opening for, especially for physicians, right, that are so laser focused, no pun intended, sometimes on performing surgery and procedures. They may not realize what their phone tree sounds like, or what it's like to check in, in their own office.
Yeah. Yeah, it's phenomenal. I mean, we had a practice last month. We did an insights call, and she was like, it's so valuable to have the internal feedback. And of course, everybody loves the reviews, right? The reviews, they go kind of without really being spoken about, and there's a whole next level of reviews for, if we want to nerd out on those in a minute. But she says to me, she says, "Hey, Ryan, this is phenomenal feedback. Like we always thought, like, our lobby had these chairs that weren't great, in specific, right, in the ophthalmic space, which you and I have met and worked in. The number one driver of dissatisfaction is wait time, right? So, and that's not new news, I don't think, to many people out there, but so they're getting a ton of feedback on their chairs. In
Yeah, if
the
you're waiting, you're gonna be sitting in an
That's it.
uncomfortable
That's
chair.
it. And they've had these outdated chairs. So guess what they did? Boom. They got enough feedback. They took it to the leadership team, said, it's time, it's impacting our overall experience. And that's it. The days are gone where the provider controls the whole decision.
Mhm.
There's too much choice. And so, if you have a bad experience with the front desk, if you had a poor experience with scheduling, you're going to go somewhere else. And learning that feedback in real time, changing your chairs out. We had another customer recently got a lot of feedback on voicemail messages not being returned, people calling the practice not being able to get in to actually schedule an appointment. Like step one, can they schedule an appointment? And they had to change their phone vendor, right? They're constantly listening to this feedback, getting real-time feedback, and they changed their phone vendor out. Now they've got a new phone vendor in there. They haven't had these same issues. So it's remarkable what you can do and what you can achieve when you take action on that feedback.
It's interesting. Yeah, not getting a call back would be super frustrating, or
Yeah.
having to sit in an uncomfortable chair for an uncomfortably long period of time would be frustrating. I'm wondering, is there anything that seems to stand out in the positive comments that tend to come in, that if I'm a practice manager, like, what could I try to emphasize to drive more positive comments? Is it usually like about a specific person, or is it like, oh man, I love the little snacks you have?
Yeah.
Anything on the positive side that?
Yeah, 100%. I mean, I've got endless reams of data, which is informing all of this. But the number one tip I would give today in terms of the positive side is a patient's name.
Mm,
That's it. Mike, right?
mm,
And it's a two-way street. And so what I mean by that is personalizing the experience. I've been in the tech space for a long period of time, the customer experience space, and it's all about personalization. It doesn't matter if you're running it doesn't matter if you're running HCA, the fourth largest hospital system in the United States, or if you're running, a small one doctor practice. It's all about personalization, and it's connecting with each and every single one of your patients, right? Take the time to say, look at the chart, right? Say, this is Mike. Mike, good to see you. And if you don't remember their name, or if you don't have it in front of you, it's okay. Hey, I'm so sorry. I see a lot of patients each day. Would you just remind me what your name is? It's been a long day for me,
yeah.
right? And connecting with these patients, using their name, doing that personalization. There's a whole other side of this, right? In in the tech space, to make sure, right, appointment reminders, et cetera, using the patient's name. But That's the number one thing,
Wow.
greeting them when they come in, the scheduling. Hey, Mike, thank you for calling us today. I mean, I've got 100 ways to do it, but that's arguably number one.
Dale Carnegie said that's people love to hear the sound of their own name, right?
Yeah.
So that's fascinating, and that's definitely something that I have trained technicians, employees, MAs. Hey, greet people, use their name. People love to hear that.
Yeah, and it just creates that personal connection, right? It's so paramount. I mean, I can tell you so many different business decisions that have been made as a result of that, and it creates that instant connection between the provider, the tech, the front desk. It really doesn't matter. And the other thing too, and again, low hanging fruit for those who are listening, but wear name tags, and it's a two-way accountability marker. I mean, you can look at it. We can reference the number one quick service restaurant in the U.S., but they have name tags, and the reason everyone has name tags is so that person says that other person's name, and then guess what? It creates reverse accountability.
Mm.
And so now, as the employee, you want to know what their name is, right? Because they're using your name all the time. It's a weird psyche thing, and
Mm.
it works. It's so proven, and we see a disproportionate number of 5-star online reviews using employees' names when the practice wears name tags.
Wow. Well,
There
there
it
you
is.
go.
There it is. There's another one for you.
I'll make a clip of that right there.
There it is. Yep.
Well, Ryan, that's great feedback. I'm wondering, like you talked about your story of trying to find a provider for your
Yeah.
mom, and I've been in this situation, right? I've got to find a new doctor. I've got to find a doctor for my son or my daughter or my wife, and I kind of have a perspective on this, but how important are those reviews when, to a business and getting those patients? You talked about how hard it is to get a new patient.
Yeah.
Talk about the importance of reviews in patient acquisition.
It is arguably the most effective way to drive new patient growth, regardless of industry.
Mm.
Period. And 5 years ago, I would say everyone was getting into reviews, right? Consumerism is in healthcare. We're all purchasing on Amazon. We're all looking at product reviews. It is absolutely transcended healthcare. And it's critical. We're to the point now where our customers are, we're doing targeted growth. And so what I mean by that is, we had a customer the other day who sent us an email and said, "Hey, thank you so much. This patient found me, who's looking for a particular type of. There's a product called a light adjustable lens."
Mm.
From a company called RX Sight. Anyway, it's an adjustable lens as a part of the cataract surgery process. And they found one of our customers, our docs, who's top rated, who does tons of these procedures online as a result of his reviews. And so they said, "Hey, I want LALs, which is light adjustable lenses, from you as a result." It couldn't be it's so impactful. I mean, myself, for example, I need shoulder surgery, unfortunately, right now,
Mm.
and we'll be having it after the first of the year. But I went online, and this is a 50 doctor orthopedic practice that's top rated, and I was looking at them. And they had scheduled me with a consultation with one of their providers, and so they're top rated practice. And then I go and I look at the provider, and he's like 3.2.
Ooh.
And again, it's a pretty minor surgery from my understanding of my own research, but I had a consult, and it wasn't the best experience, and I did choose to go in. Needless to say, I looked for another provider immediately. So it influenced my decision, before I walked in that door. I mean, the practice was top rated, no doubt. But unfortunately, the doctor who's doing my surgery was not. And so I think that's, one of the things now. Consumers are smarter, right? That we're constantly getting smarter. They're looking at the doctor review who's going to do the surgery. They're asking, how many surgeries have you done of this, in the last week, in the last 30 days, right? You want the expert who's doing a ton of these. And so, yeah, I mean, from a growth perspective, right? I mean, I changed my decision based off of, that. And, my new guy, right? He's 4.9 rated tops, hundreds of reviews. I mean, he does, about 45 of these a month, very high volume, very trained. I mean, it's, I couldn't be in better hands. And I think the other thing too, Mike, as it relates to healthcare, there's a lot of referrals happening, right? And so there's referrals coming from one practice to another, regardless of the specialty, regardless of what it is. And what I see a lot, and we like to say, don't lose the referral. I mean, you could even be a med spa. It frankly does not matter. But if I tell you, hey, Mike, you should go check this other practice out, or I want you to go here and I'm going to refer you, what's the first thing you're going to do?
Yeah, I want to go see what they're all about. Who am I getting sent to here?
That's it. You're going to Google them. You're going to look it up. You're going to say, what are their ratings and reviews? And do I want to go here or not? And it's new patient growth is key. It is probably arguably the quickest way. I mean, our customers, they pay for their service in the first 4 months. I mean, it's unprecedented, the amount of new patients. And it's funny because most of our customers are like booked out 3 months. And, we always say, like, it's great to be booked out 3 months, but don't you want to be booked out 6 or 9 months?
Raise the bar.
I mean, seriously, I'm not joking about that. Those are real life results. And, and that way the providers can spend the time in the operating room where it makes sense. Right.
Well, here's a question. Let's say I'm a shoulder surgeon, and my reviews aren't so good.
Yeah.
Is it recommended and is it possible to have a patient change a review?
Yeah. So, we have a framework that you can use to reach out to a patient to try and get them to change a review. So in the example, let's say that somebody does burn you down, and they give you a 1-star review. It's service recovery from the beginning. There's a process to it. It is somewhat, very methodical, but, step one is reaching out. And that's step one, right? So Mike, let's say you write a 1-star review for this shoulder surgeon. They see it, they get alerted immediately through our system. And step one is to reach out to the patient. And we've got some frameworks to do that with, but, you reach out and, you need to learn more and reaching out or following up is step one. Learning more, trying to understand what happened, right? Was it scheduling? Was it billing? Was it medical care? There's so many different facets to healthcare and that experience from end to end. You have to learn and figure out what it is. And then it's, sometimes you have to eat crow a little bit, or you have to apologize. And, a lot of people say, oh, I don't want to apologize because my insurance company says I can't say I'm sorry. I'll get, litigation. And, again, I'm not an attorney, so don't take this as legal advice, but, you're also human and you run the practice a lot of times, and a lot of times you own the practice. And, saying sorry, and you guys can, everyone who's watching can Google the results of, there's a massive study that was done on providers who apologized versus those who didn't, and the repercussions of those. And essentially the output of it is those who said they were sorry, had a lower risk of liability. So I'm not just sitting over here making these things up, but like, it's put yourself in those shoes.
Mm.
Hey, they messed up. Please just tell me you're sorry, right? You're going to fix it. You're going to do this. And then you have to ask them, right? So the hardest thing, hey, we did see you, we saw you left a 1-star review. Would you be open to adjusting it if I can make this right for you? And, and then again, going back to try and fix it. And some you're going to be able to get them to change, and some you're not, right? Because some you've messed up so bad that they're not, you've lost them, right? They're not going to come back. Most people who leave 1-star reviews aren't coming back. And I think that's the thing that I've tried to educate our customers on is, 1-star reviews, that means they're already gone. You need to get them earlier in the process. You need to get the feedback where it's, hey, the front desk was talking to each other and you're following up on that, not when they're leaving the 1-star review. They're super upset because unfortunately the 1-star review, it's too late. They're gone. They're burning you down. They're going to a brand new provider. So you can get them to change it. And we've been very successful helping our customers get negative reviews changed. However, we have a little bit of a different approach, which is, let's prevent the negative review. Let's address that on the front end. So you're not getting these negative reviews because it's too late at that point.
Yeah. Well, awesome. Ryan, this has been super insightful. I'm super passionate about the patient experience, and there's so many parallels with the employee experience as well. And so I feel so much brotherhood with you on this topic here. And thanks for joining me. If people are interested to connect with you, learn more about patient experience and satisfied patient, how can they get in touch with you?
Yeah, best way is, I'm super personable. I think, Ryan at Satisfied Patient, easiest thing on the planet, right? It's somebody's email address. I think it's, everybody hides behind, a paywall and this and that. And, I'm a little bit old school, my mobile phone number, like yours, Mike, I think why we gravitate towards each other is on every single email signature that we send out, right? Because if you need something, there's nothing better than just calling somebody. And guess, I had a customer call me the other day and they go, you answer the phone. That's what we do. You just answer like you called. So yeah, Ryan at Satisfied Patient, or give me a call, and would love to talk to anybody out there that needs some help.
Awesome, Ryan. Well, thanks for being on the show, and thanks to everybody who's been watching and listening. If you're listening to the recorded version of this show, this is a hugely important topic, and I promise to bring more awesome guests like Ryan here on the show, because my goal here for Healthcare Leadership Live is to help make you a better leader, help you to create a better patient experience and a better employee experience and a better experience for the providers and clinicians and everyone working in your office. I truly believe that we can create win-win-win solutions in healthcare. So we're going to continue to work towards that goal. Thank you for listening. And with that, go out there and lead with confidence.